I'm Dr. Marcia Sonity,
And I'm Dr. Caleb Moore,
and this is
the Free Smiles Podcast.
So today, we're talking about, I don't think it's a controversial topic, but I think it's something that is probably the most asked about, I think, in just medicine in this country. Obviously, we live in the United States. So dental insurance is our topic of conversation. So I feel like we do get enough questions about it, and just over the years it's changed, and just the different dynamics of that, why it's changed, what that means for our patients, and kind of the differences of a fee-for-service office, what that means, or an insurance, an office that is in your network, or a provider that you have found that's within your network.
I think the one thing that hasn't changed is the reimbursement rates.
No, actually,
So-
there's a excuse me, a statistic, and I don't remember. It's like for the past 20 years, the reimbursement amount for dental insurance has stayed exactly the same, but the inflation and the cost of provided services has, like everything's like going up in price and cost.
Yeah,
But the reimbursement rate's still like $1,000.
it's crazy. I think where we should start, if you would like to explain, because it's like you said, it's not controversial, but I think there's a lot of misconception in what dental insurance is. How does dental insurance differ from medical insurance?
Yes. So, and I'm not a medical or dental insurance expert, but I've worked alongside of a lot of people who do dental insurance billing, and I actually know people that do coding and do this stuff. And from my experience, so dental insurance it's almost like a stipend. Like you get this amount of money. We'll say it's $1,000 for like easy math today. So you get $1,000 to use for the year. It doesn't mean that once you have used that $1,000, then everything is covered.
Yep.
Like medical insurance, you have your deductible. So, okay, my deductible is, let's say it's $5,000. If I do X amount of services, I go to a hospital, I have an injury, I need, surgery on my foot, I pay my deductible, the $5,000, and then everything after that is usually covered. So that's I think the confusion of the two different things, because in dental insurance it's not that. It's literally you come in for a cleaning or a preventative thing, like that's different. And then if you need a crown, say your crown is $1,500, but your insurance is only going to pay between 50 to 80% of that cost up to $1,000. And then once you max that out, so say you need a build up and a crown, whatever that may be, if that is $2,000, let's say, but your insurance is only going to cover 50%, then that's your $1,000, and you are responsible for the rest.
Yeah, and I think what's interesting about that is even preventative treatment, on some plans, it's deducted from that amount.
Exactly.
So if you had any advanced imaging or, your cleaning or exam or whatever you've already had for the year, and then it's October and you need a crown, well, you've already used, let's say $400, $500 of that amount, and then they're only covering 50% of the crown. So I think, like you said, patients are just really confused on what are they paying for, and why do they still have to pay money for the treatment? And I think that's where the confusion comes from.
I think that is the thing. Like the confusion comes from my front office, my team. We have a designated person who literally handles insurance. And what she does all day is, she's been doing this for 20 something years. That's her realm, is submitting claims, submitting pre-authorizations, understanding what different things mean, like a PPO versus an HMO. We can get into that a little bit. And, because my office is a fee-for-service office, we do try our hardest to get reimbursements for our patients, because a lot of our patients, we're not in network with anything. So the confusion comes from, hey, my insurance, I have this dental insurance. They just come in and they're like, I think I faced this more when I was working for a practice where I was in network with things, because people would find you because they're like, hey, I just started a new job. You're listed on my insurance in network with Delta Dental or whatever it may be. And, can you be my dentist now?
Yeah.
And so when my treatment coordinator would be like, hey, this is, the things that you guys talked about today, prioritize this, this, and this. this is the treatment plan, and then at the bottom, we always go through like patient responsibility or the patient portion of that bill. Even though we say it and it's even written, like you're responsible for
Hmm.
X, Y, and Z of this, when it came time, like let's say that service was denied by the insurance,
Yep.
which is a whole nother topic of, I think we could get into that a little bit too. But when that is denied, or when your insurance pays less than what it estimated to pay, then it really is, it's confusing and it's frustrating,
Hmm.
as a consumer, of someone who, if you have dental insurance, you're expecting the thing that you pay for, the service that you pay for, to pay for something. But I think we need to rethink how it's a company. It's a company there to make money. It's not a company. I mean, I think insurance companies in general, they're not providers. They're not healthcare
Yes.
people. They're a for-profit organization there to profit off of what you pay them.
Exactly. And to piggyback off of that, so, they're going to find, in my experience, find reasons to deny your claim,
Oh,
right? So
yeah.
they don't have to pay it out. So I think it's really important, if you're in that type of environment, if you're practicing and you're in network with PPO plans, you have to take a PA within, 6 months or a year for that crown prep. You have to be able to show, the roots, you want to see the apex, because if not, it's going to get denied. Like little nuances like that, they will come back and deny the claim, and then the patient is frustrated because they're not receiving the benefit, that they're paying for.
Yeah, well, I mean, piggybacking off of the whole denial and what insurance, like, I think we go above and beyond. And I think a lot of doctors try to do this for their patients.
Hmm.
Is not only are we taking the right x-rays that we
Yeah.
need, we're explaining why we need the x-rays, we are taking, I take at least 4 images on every single crowned tooth that I do.
Yeah.
I'm taking it before, like, if I'm taking off an old crown, I take a photo once that old crown's off. I'm showing the decay, that not that it's still on the x-ray to show,
Yeah.
but I'm taking a physical photo to show that. And then I'm taking photos once I remove an old filling that's there to show any cracks, breakdown, height of walls that are left,
Yeah.
reason for buildups, and things like that. But that's, I think, people understanding that the extra time that we spend taking these photos, submitting these, like, that's a lot of energy. We have literally an
Hmm.
entire human that we're paying to go through all these photos, submit these claims. It takes, I mean, it takes so much time, like per claim, and then writing narratives out and doing all this stuff. And obviously, there's systems to try to, get these claims to be accepted better. Like, you have things that, you always submit for, or whatever it may be, or all the things that they want, but they're still going to deny it because there's certain insurance companies that will always deny it until like the third time you submit it,
Yeah.
which is crazy.
Yeah.
It's just like the almost like their way of doing things. They're like, oh, no matter what's happening, this could be like the most obvious thing. Like a tooth literally fractured and broke,
Hmm.
and there's literally half a tooth there, and they're gonna be like, well, we're just gonna go ahead and just check the box. No, send it. But and it's frustrating, and it is frustrating for us because we try to provide a good service for our patients. At the end of the day, we just want to be, good doctors. We want to be good. We want our patients to leave happy, and we
Yeah.
want people to be healthy and to keep their teeth longer and do all these things.
One of the things that you said earlier about new patients coming in, and one of the first things that they say to you is that I found you in network.
Mhm.
I have a hard time with that statement because everyone wants to be, we want to give the best care that we can, like you said. And I want patients to come to me word of mouth by referrals,
Mhm.
and because they know that if they see Dr. Moore, that they're going to get exceptional care. And so right off of the bat, when they come in for that exam, and that tone is set at, you are network with my insurance,
Mhm.
it sets a tone of what do you value here?
Mhm.
What are you valuing in your dental health? And I can come up with a plan that can be comprehensive, and I can take care of you in the best way. But if you're only wanting to do what insurance will allow you to do, or if you have multiple issues and your value is based on, who's in network for you, we can only tackle one tooth essentially this year,
Yep.
when you have six teeth that need help. So that's where, for me, it's a little frustrating, and I don't want to change the way that I'm, providing care for patients or treatment planning,
Mhm.
but there's already this boundary that, or not even a boundary, a barrier that's being set from the beginning and when they come in and say, well, you were just in network and that's how I found you.
Well, I mean, I think it's different for everyone. Some people really don't mind who's
Yeah.
their doctor. They don't mind the end of the day with the care they're getting. They just want to kind of check a box on things they I went got my cleaning done. I did this.
Hmm.
I did this. That's kind of the outlook of that. I think and I guess it's a personal choice. I have always kind of over the years kind of sought out providers. Like I see a naturopathic doctor,
Hmm.
I see a certain PA that isn't, they've never been in a network with many of my things, like because I don't get the same amount of care that I think I want. And to me, it's worth paying it out of pocket to see a naturopath to get my blood work done, to have them read that versus going to whatever that physician is that's just gonna, you know,
Yeah.
do the general things, and then you're gonna, like, what's that paying for anyways? So I think that's why we changed our personal insurance into a like a health savings account at this point,
Hmm.
because we're young, we're healthy, we don't have a lot of things going on. I think an HSA plan, I think a lot of people are more switching to that. That is an option because you can go anywhere. You can take that money. It's essentially tax free.
Hmm.
Use it for anything in health. And then that's your way of paying for things tax free. But it's a good option for people having that HSA plan because you really can see who you want to. You can find the person that is that person that you drive with, that you trust, that their care is good, that you agree with, or the plan that you agree with. And it just gives people more options.
Yeah, and it's not to say that, providers who are in network with these PPO or HMO plans aren't great providers. There are a lot of great providers out
Oh
there
yeah, for sure.
who are in network, but with the understanding of it's all about communication and how you are explaining. A lot of patients don't understand that it's just a coupon, so it's not like it's going to cover everything. And if you need a comprehensive care, this is really just a discount plan for you. So, a lot of offices are switching over to in-office memberships,
Yep.
which I think is a great option for patients.
Yeah, that's true. Yeah, that's true. We have a office membership plan. We also have different cash discounts because a lot of our patients are just cash patients. So there's different payment options like Care Credit, Cherry,
Hmm.
things like that that are like low interest ways to spread out payments for bigger work or things like that. I think that's great for patients who, especially even if they pay cash for things, I think the ability to spread payments out and like budget things. I do this even with like our ski pass. I
Yeah.
put on like the Affirm thing because I like knowing that every month I'm paying this amount instead of paying the full amount right now,
Hmm.
even though there's no interest on it.
Yeah.
It's the same money at the end of the day, but to me, I know my monthly budget differently, and it just sits better with me for certain things.
Yeah.
So yeah.
And I agree with that. And I think the membership, in office membership, if you need comprehensive care, it could be a better investment
Mhm.
than the dental plan.
Yeah.
Because at the end of the day, the dental plan is only going to cover one tooth, maybe two, you
Right.
know. And if you need SRP or if you need any perio treatment, what are the reimbursements for that as well? So it becomes very tricky for patients to budget all of this when their perception is that the dental insurance should be covering it.
Yeah. Our patients, like we have a lot of patients, or I've seen a lot of patients over the years that they lose, like they're switching jobs or they're going into retirement, and I
Hmm.
think that's a huge patient population of, do I invest into a dental insurance? Like, do I get my own dental insurance at this point? Or do I go on like your in house membership plan? And a lot of patients, the membership plan makes more sense because it's covering your cleanings every year or your whatever that may be. When we have two different ones, we have like a regular, like your healthy teeth, healthy gums.
Hmm.
So you get two cleanings a year. If you're on a there's a perio plan. So if you have perio, then like you're on this plan. So then you get your 4 perio maintenances. You're not fighting with insurance, you're not battling that. You just already know, like, this is what I'm paying every year. And for a lot of retirees, just knowing that's what your budget is for, and you're keeping your health of your mouth during that time,
Hmm.
it's at ease. Because I think when you lose insurance and you go into retirement, there's a lot of anxiety I think patients feel because they're like, well, what if something happens? What if something happens? Or what if I still, like, you still want to maintain your health in retirement? It's not like when you're 60, you're just like, oh, I'm good now. But a lot of people, like, they find that they can't do those things because they're like, oh, they're kind of in turmoil. So I always kind of direct them to like, hey, let's talk to our like coordinators. Let's see what your options are. Because maybe there is a benefit plan that is with an insurance that we work with that does tend to like work better with us. Like they're not denying as many claims. They're
Yeah.
not being as this way or this way. So I think it's a good resource if you're trying to like if you're moving, trying to switch offices. If they have a really good resource for insurance stuff like that, just talking with that office and if they're willing to work with you on that, I think that's a good sign as well because they have an organized team to do that for you. Yeah.
I want to talk about quality of life for new doctors who may be listening.
Yeah.
Graduating doctors who are considering, because I think there's a shift and new graduates coming out and they're not having the option or the availability of these fee-for-service offices.
Mhm.
I really think it's important to step into, if you're going into a DSO or a practice that's in network with insurances, to have an understanding of what your day-to-day is going to be like.
Mhm.
Number one, how beneficial it can be clinically for you.
Yep.
But number two, how to navigate that clinically and in communication with patients. So that way, at the end of the day, your patients are receiving the benefits that they're paying for and you're not fatigued at the end of the day.
Mhm.
So what was that like for you stepping into practice out of school and going into an office that accepted every insurance,
Yeah, I guess that's a really good question. So before I went to dental school, I kind of want to go through like a little history. So before I went to dental school, I was working with an office that as a hygienist, they only were in network with one insurance. So as a hygienist, I really knew that I could, give a really good quality of care. I had 2 hours with every new
Yeah.
patient.
The time.
I had a lot of time, but obviously I had worked really hard to be able to work for a fee for service office. And you kind of, there's just certain skill set that you need to have to perform at a higher level
Yep.
when someone's paying you cash to do those things. But just going from that to being into an office that literally they put me on every single insurance. I didn't necessarily know that.
Mhm.
I think when I went, I didn't think about that because the office that I was working with before that was fee for service was now this DSO bought these practices that were I didn't know they were in network with all these things. So to me, it was a little bit of a shock when they were like, "Hey, no, we just need to put you on all these things." There was someone in the background just like entering me into a bunch of different insurance contracts and whatever it was. And I didn't actually know how many insurance companies that I was working with.
Mhm.
So if I would have, go back in time, I think I would ask that question. I think that's really important to ask is, hey, how many insurances is your group in network with? What are the reimbursement rates for certain things?
Yep.
I would definitely ask that now because I wasn't aware of that at that time. So I think it's knowing what the insurance rates and the reimbursements are, and that might not be the right office for you. Or it might be. Maybe you like everything about that practice. You like the team, you like the location. Those things just work for you, and the reimbursement at that time it's not a big deal for you.
Yeah, and at the end of the day, with the reimbursement, it's a faster pace. So,
Mhm.
if your office is trying to stay afloat and you really want to take care of people, you don't have as much time to reach those goals to complete these procedures. Whereas maybe if patients are paying cash for the treatment and you're collecting all of that, you know, then you get more time. You can set aside 2 hours for that crown prep and not have to stress so much. Um, there is a lot of benefit in the grind of it and in getting clinical efficiency, but mentally, I think it becomes really fatiguing for a lot of providers.
I think that was the biggest thing for me is
Yeah.
just the mental exhaustion. I think I took well to the pace of certain things,
Hmm.
but you know, it's medicine, it's dentistry. Not everything goes as planned every single time you're planning that crown on a different patient. So this person needs X amount, or this happens during that procedure, or you find something else while you're doing that, and that adds time. And then you're behind a little bit. And then you're needing to communicate with your team more about doing hygiene exams, having to move patients around. Oh, like, say you open up an old crown, underneath it, it's more bombed out than you thought. You're really
Yeah.
like, hey, this tooth really needs to come out. What are you going to do for that patient that day? Are you going to
Hmm.
be the one to extract it? Are you going to temporize it that day and send them to the oral surgeon? Are they going to be in pain? Are you going to initiate a root canal at that point? All these things can happen. And I think on the patient side, you don't, your patient doesn't really, that one that's waiting in the waiting room to
Right.
come next, they're not like, oh, they're probably, they're just knowing that you're behind that day.
Yeah.
And I think that to me probably got to me the most was just knowing that I didn't have any wiggle room in my schedule, because I knew at the end of the day, they were expecting my production to be X amount of dollars. I needed my production to be X amount.
You also have a team,
Mhm.
that you have to pay for, and your team is relying, this is their livelihood.
Mhm.
And so the office has goals for a reason to reach production values, because we're supporting a team of people, and we're all there to help people. We're not there to make money. You and
Well,
I,
yeah,
we
but
don't
you're
operate that way.
exactly.
And we're there to help people. But at the end of the day, when you're under that PPO plan, when your reimbursement rates are lower,
Mhm.
you're going to deal with those things, and you're going to be more fatigued.
It
And
is more fatigue, and you really do. It's a little bit more pressure, and at the end of the day, you're trying to kind of weigh that in your mind mentally and not get bogged down by it. But you think about it, like there's like a certain amount of numbers that you need to hit to support a certain amount of people up front. So if you're only producing this much, you can only have this amount of people working your front office, meaning that, okay, maybe you can't have a designated person that does insurance. So then it falls on your office manager at that time. But she's also trying to like manage the practice,
mhm,
do scheduling things, help with answering the phone, help with like doing all these things throughout the day. But then she also has to submit insurance claims, fight with insurance. That is, I think I felt more fatigue from my team members during this than I did on like my own, like the dental part of things.
mhm.
I think the fatigue that I felt was my office manager being exhausted trying to do all these things, because we're trying to, build the schedule, do all this stuff to support her job. And also you're supporting your hygienist's job at that point as well.
Yeah.
Because any kind of PPO plan, if they're coming to you, the reimbursement rate also falls lower on your cleanings. So you can only pay your hygienist X amount of dollars, or you are losing money per hygienist because you're only getting reimbursed less than what you pay them.
Yeah.
So your production also has to support the hygienist's salary as well. And I think a lot of people don't understand that when it comes to working with an office that is that way, that you're, as a hygienist, if you're coming in and you are doing, insurance based work, you're expected to produce as well. You're expected to produce this many
Hmm.
numbers, but you're also not making enough to support your own salary. And I think that understanding is really hard for people.
It goes back to what I said earlier, that, there's a lot of fatigue that comes with that as a team. But at the end of the day, I find that there is value in place for it,
Mhm.
because access to care, a lot of people can't afford, cash or self pay. And in those, early years out of dental school, having the support from, the DSO and the insurances, and seeing that volume, the repetition, you're going to learn a lot about who you are as a provider,
Mhm.
both clinically, with outcomes, and also how you communicate with people and work through barriers. So I think there was a lot of value in it for me.
Mhm.
Um, but really, I just want to transition. What has it been like for you now that you're at a fee for service office, and what changes have you noticed, and how are you feeling?
Um, I I feel like a different person. And
Yeah.
I know that sounds so like over dramatized, but I truly do. I'm feeling better. My relationship with my husband is better because I'm not coming home and just
Yeah.
being exhausted. I think that's probably the biggest impact. And my husband will say this as well. Like I really was like a different person. I
Hmm.
was like exhausted. Where now I just feel like a normal person. I can come home, I can make dinner, I can do
Yeah.
things. We can make plans for like seeing people. I can make plans on the like we went out last night. So usually on Fridays we're like, oh my gosh, we're dead. We don't want to do anything. But we were invited to an event last night, and I felt like I had the energy to do that. Like I had
Yeah.
no problem just being like, yeah, let's go out for a few hours, see so
See
and
some
so, meet
friends.
some
Yeah.
people, whatever it may be, and it was just so fun. And I
Yeah.
think just getting like your life back and just not feeling like you have bags under your eyes every day. Not that every day was like that. I shouldn't really say it like, like it was all bad, because I think I truly just love what I do, and the dentistry part of it and working with people, no matter who it is, I really enjoyed.
Yeah.
Um, but I will say that my overall just life is better at
Hmm.
a fee for service office and the practice that I'm at currently. Yeah.
Yeah, and you being your best self allows you to take care of people better.
Yeah.
So
Oh, I have so
that's
much, like, I want to talk with patients for a little bit longer. Like, I
hmm
really enjoy like getting to know my patients, talking with them, knowing more about them helps me to make a better plan for them and just make that connection. I have so many more patients that are then referring their, mom or
yeah.
dad or what. If I'm meeting people, like a lot of my patients that are new patients are word of mouth patients,
Hmm.
because they're not worried about, oh, my insurance or this or that. It's like, hey, this is where we need to be. Their goals are aligned with wanting to do certain things to keep their teeth or to prevent certain things. And that's really what I want to do. At the end of the day, I want to be able to help people. And it's not because patients that I'm seeing are more wealthy or
Yeah.
anything like that. It's just their goals and their values align with their care, and they want to invest into that. And that's just that, it's just more of a mindset of anything. Yeah.
It's great.
Yep.
I think it's really important for listeners out there to know that, whether you're a new graduate looking for an office, ask those hard questions of, what insurance are you in network with? What is my day to day look like? What is expected of me? Um, and then for patients as well, to ask those questions of, if you are out of network, what does that mean? And are there membership plans? Um, but yeah, I think overall, this shift from an insurance-based practice to fee-for-service is a trend that's becoming more prevalent,
Yep.
and there's definitely a reason for that. So thank you for sharing your personal journey throughout that.
Well, thank you. And we'll see you guys next week.
Yeah.
Thank you so much for listening. If you enjoyed this episode, please share it with a friend. Don't forget to leave us a comment, rate us, and subscribe so you never miss an episode. We appreciate your support and look forward to bringing you more great content.